I think there is a misunderstanding here as to what is happening. One thing is to seize, which assumes you take. And another thing is the application of the decree relating to the state of emergency. That's why I've said that people in Gibraltar need to familiarise themselves with it in detail. There can now be no movement of medical supplies in Spain and no exportation of medical supplies in Spain. That's what the decree says. So if you've bought anything, it can no longer be delivered to you, unless the Department of Health in Spain agrees. This is therefore a second caveat, which means that, for example, our experience, if you've already bought something and it's been delivered to you, as long as that is confirmed, then it is released to you. If, given our circumstances, we require additional material, and that source of the source of that material is in Spain, we are likely to be able to continue to source it. It just requires the second filter of the Department of Health in Spain confirming that it can be sold. This is as much an attempt to stop profiteering as to ensure that the stocks available in the country are available for the citizens of that country, which is perfectly understandable. But there's no attempt, and we mustn't, because of our history with the Spanish issue, etc., we mustn't fall into the trap of thinking that Gibraltar is somehow having its medical supplies seized by Spain or denied by Spain. That is not the case.
So supplies continue to come to Gibraltar as planned?
With the difficulties that movement is now curtailed, and therefore the supply lines are not seized up, but they are slower in delivery.
The swabs have arrived, for example. They are medical supplies and they're in our possession already.
And is there anything that is in that pipeline that you need that you haven't got already?
Well, look, I think you want an honest answer, and I've told people that I'm going to be 100% honest with them all of the time. All of it. Every health authority in the world, whether it's public or private, needs to get their hands on as much of the material that they can to deal with this issue as soon as possible, because as we don't know when the curve is going to hit us at its sharpest, however much we flatten it, at one stage it's going to be at its highest with us. We're going to want to know that, and you're going to want to know that we have everything that we need and more here already. We have a lot here already, we have that confidence, but everything that we've got on order, we would like to have in Gibraltar as soon as possible.
Today we have received quite a number of cylinders for the hospital for this epidemic. But plus all the cylinders we had ready, available for Brexit, those will come into action once we establish the requirement. We've got one of those types of cylinders. We've got about 820 cylinders of those 20 liters. We've got about 86 of the 10 liters, and the other small cylinders that are handy, available, ready and available for the patients. So we can cater for all their needs, at home or in hospital. Yeah. On this Friday, we also expect another lorry from Spain to arrive, and another 200 to 300 cylinders will arrive for the use of the GHA. We are not having any difficulties in passing through the frontier at present. We are constantly in communication with the Spanish authority, Guardia Civil, and they confirm there's nothing. We've got the green light for any exportation of medicinal supplies. So on a regular basis, we are receiving goods from the frontier at present.